Hey guys, it is Dr. John Palmer from Friends and Family Health Centers in Birmingham, Alabama. So today I'm going to be talking about the utilization of our healthcare system in America. It's touchy because typically when people talk about it, it comes from an emotional state, not very scientific. So I'm going to do my best to be as scientific and as non-biased about this topic as possible. I am a chiropractor. I run a naturally centered healthcare center here in Birmingham, and we get people well from many different things without the use of medicine. Not saying the use of medicine is bad, it's just that building that natural end, that conservative end of healthcare is important. In America, we have a really great critical emergency healthcare system. It's actually #1 in the world. But one thing that we've tried to do in America is we've tried to take this critical healthcare system that is based off of symptomatology, getting people's symptoms to reduce, keeping people alive, and we've tried to turn it into a true healthcare system or a preventative healthcare system. But the thing is, health doesn't work like that. You cannot take a medication and truly make the body healthier. You can remove a negative symptom, but you can't make the body healthier taking medication for just the reduction of symptomatology. And typically it needs to be done on a short-term basis, but we've taken medicine for a long-term basis. We have a culture that we have had in America for the past 100 years that we have a growing list of that we have medication for every single symptom that the human body has. And so the bad part about that is we should be educating on how do you have the best functional body without the intervention of medicine. Granted, I want to have medicine if I need it. I want to have it in an emergency state. I want to have it if I have something wrong with my body. But in the majority of America, we teach people that they need medication at every wrong thing, every symptom that pops up in their body, and that's wrong. We need to teach people that symptom actually means something, and then it means that there's a dysfunction there. It means that you can actually create usually the same reduction of symptom that you can do with a medication, you can do with a behavior change, with a lifestyle change. And if we teach people that, you're gonna have a lot healthier healthcare culture, and you're gonna have a lot healthier public. You're gonna have a lot more people with a quality of life that they love instead of they hate. It's gonna be cheaper. Well, cheaper to a degree. To have a disease is very expensive. It's extremely expensive. So what I want you guys to understand is the utilization of our healthcare system should be along the full spectrum, not just this system here, not just the medical system. You truly should also understand that what you teach yourself of how do you run your body should be almost given to you at birth, saying this is how you run your body. Does it work like that? What we give in our clinic is something we call as the 5 foundations of health. It focuses on brain health, spinal health, the nutrients you put in your body, exercise, and then toxin removal or reducing toxin load. And so the whole point of us giving that template to people is to have success, to get them past that point of symptomatology, reduce that, and so they can have a life that is fruitful to truly make their body better. In America, we have this horrible trend of that if you get on one medication, you get on more. Very rarely do you get off of your medications. On a regular basis, in conjunction with a medical provider, we typically can get people off of their medications, but it's actually someone that they have to make that decision. Typically, people want to get off of their medications after they've been on them a long time. They just don't know how. And so you need to have someone also being that other information source of telling you, this is what you need to do to be healthy. You also need to have a medical provider telling you to have that other representation of that healthcare system. So hopefully this made sense and you have the ability to just have a little bit more clarity on truly how to use that. Truly needs to be understood. Emergency care truly is critical. It needs to be medical care, and then conservative care needs to be what you use most of your life. So thank you for listening. I hope you learned one thing. My name is Dr. John Palmer. Check out our blog post, check out our website. It's a lot of other content there if you want to learn more.